This is Mr. Greg Crapanzano, a fellow sailor.
Yeah.
He's 49 years old. He's been a patient for almost 2 years, and he's been on testosterone replacement from day one. So again, that's almost 2 years. What was going on with you before we started the testosterone?
When I first talked about, I've known you for a while, but when I first started talking about testosterone, I was feeling really listless. I had no energy. I had trouble concentrating and focusing. I was slipping at work. I was suffering these kind of, like, I don't know if they're anxiety or panic attacks, but in meetings and stuff I would start to sweat and I would start to feel like things closing in on me.
That sounds like a panic attack.
Yeah, like panic, yeah.
You also, besides this, you also felt physically weak?
I felt physically weak.
On your boat?
On my boat I couldn't turn winches and handle lines anymore. I really didn't. I didn't want to go for a long sail. Yeah, actually it was. Yeah. I didn't want to go for a long sail at that time. And I was like afraid to walk on subways because I felt physically weak. If somebody attacked me, I wouldn't be able to defend myself. So I avoided subways and such too.
Any sexual problems?
What sex?
Did you have any libido?
Not really. I had very infrequent sex. Yeah, sex, I really didn't have much of a sex drive at all.
Okay. How often were you having relations at that time, would you say?
A few times a year.
A few times a year. How long had all of this been going on?
5, 10 years, a long time. It's
been
going on a long time.
So you're 49 now, you've been treated since you were 47, so you're talking about this began during your 30s?
Yeah, mid-30s.
Mid-30s?
Yeah.
Okay. And it was getting progressively worse?
Yes.
And you were also depressed?
Very much so, yeah.
Very much. Okay. So you seem to have all of the facets, all of the symptoms of testosterone deficiency, the physical, the mental, and the sexual. So then we started you in April of 2007?
April 2007.
Yeah, we started you on testosterone, and what happened?
Well, after a couple months on testosterone, I started feeling, actually I pretty much felt better after the first, second, third shot. I started really feeling good. I started going to the gym. I lost around 35 pounds. I started building lean muscle mass and losing fat. And my body started to look like I was young again. And feel like I was young.
Your energy and strength improved.
Oh, exponentially. When I first started going to the gym, I was curling around 10 pounds and I was like really weak. Now I curl 80, 100 pounds, do 3-4 reps with no problem.
What about the various mental things, the concentration, the depression, the anxiety, the panic attacks? What happened with all of that?
They're gone. They're gone. My focus is great. I'm really performing well on my job. No more panic attacks. I don't sweat at meetings anymore. I really don't have those fears. I don't know what I think that the fears are generated by this just overall weak feeling.
I think that the fears are generated by the mental circuitry that is void of testosterone. I think the presence of the testosterone in the brain suppresses the fear circuits, but I'm not a neurobiologist.
I'm not a doctor, I don't know, but you know what, it's worked.
It worked. And so all is gone. The depression is gone, and the anxiety is gone, and you can focus well.
Yes.
You have a change in your sense of yourself, your self-confidence, your self-esteem.
Yep, I feel much better about myself, about my life. My self-esteem's increased a lot. I have an overall feeling of goodness about myself.
Happiness?
Oh yeah.
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 You said you mentioned to me before that you felt, how much younger do you feel?
I feel like I'm in my mid-30s again.
Uh-huh.
I feel 10 to 15 years younger, easy.
And when other people have commented on that aspect of you?
Yeah, my sister Linda said I looked like I was 35.
Uh-huh.
Yeah.
Okay. But you didn't tell her why?
No, I didn't.
But you're going to?
I'm going to.
Oh, you promise?
I promise.
Okay. And last but certainly not least, what about the sexuality?
My sex drive is...
Maybe we better not talk about it.
No, my sex drive is, I could have sex 2, 3, 4 times a day. Yeah, I have a lot of sex, and I enjoy it. It's good quality sex.
Okay. So I guess we could sum it up and say that testosterone has been a plus for you.
Oh, absolutely. Yeah, I want to keep taking it.
Well, no reason not to.
Yeah.
Any side effects?
None.
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 But all good and no bad.
they're real good, unless you call it too much sex a side effect, and I'll take it.
That's not bad.
That's not bad.
Not bad. Okay, thank you so much.
Thank you, Barry.